Everybody. Either Tata will be preparing, there everything will come. Then I am using real-time data collection. I am using artificial intelligence, quantum computing. Then I can go for personalized medicine also. Linking with this data, personalized medicine, agriculture, education, everything, employment, everything we are going in that direction. Now I am very clear, link with that.
Okay, yes. So this 2,45,000, sir, all health database is linked, sir, real-time information flow.
No, what I am saying, 2,38,350.
Yes, sir.
It is RTGS data or your own data?
Own data of all the health systems, sir. Whatever application, we have single truth now, sir.
No, that is where I am asking again.
That should become the RTGS.
RTGS is authenticated with Aadhaar.
Yes.
You are depending same. Now, how we are that data? Don't say that is not the data. We are created our own. Then I am having a doubt that you are deviating. If there are any problems, you have to correct main portal itself. You are only a user of your constituency. He is the owner of user of his district. He is the owner of using that data for health. He is only using health. Somebody is using agriculture. Somebody is using some other area. Like that you have to think over. Or otherwise, if you say this is my own data, then I am confused totally. 1 year I am forcing everybody to align with my thought.
Sir, actually RTGS నుంచి తీసుకుని మనం ప్యూరిఫై చేసాము మళ్ళీ RTGS సింక్ చేస్తున్నాం sir.
No, what I am saying, you are take that data while syncing also,
Yes, sir.
or purification also, you do there simultaneously.
Yes.
That the same data simultaneous.
Yes,
Have a
real
separate working portal for you. That's all.
Yes.
Understood.
Technology is such. You won't synchronize, then you are going to create a problem for us. Duplication. You are doing on one platform, they are doing one platform, somebody is doing some other platform. To bring all these things, everybody is thinking this is my custodian, I am the owner, you are maintaining secrecy. All these things are problems.
మెయిన్ ఇక్కడ ప్రాబ్లం ఫోన్ నెంబర్స్ సార్. ఫోన్ నెంబర్స్
That is what I am saying. They have collected X phone numbers. You are collecting Y phone numbers. Okay. First of all, those that they don't have, you are collecting. Give it to them also simultaneously. Sync.
We'll sync it. We'll sync it.
Otherwise, same agency you are making. That is where I am following. Same TCS is developing that. Same TCS you are diverting. You are diverting. That is what I am saying.
Sir, people keep changing their phone numbers often, sir. That
No,
is
no.
another problem.
There also no. There also we are asking them to update continuously. All these sources has to update and sync with that, and also assure that phone has changed. He will give his address, phone number.
That should be authentication.
No, we'll synchronize it with one signal workload. We'll ensure that, sir.
Now I am asking you, your patients, you are using Aadhaar,
yes.
Yes, sir.
then automatically everything will come. But only my worry is dynamics are there, static information is here. How is it static? Family as on today is semi-dynamic or static. Suppose family is divided, some other family will come again. Then third one, Aadhaar is permanent. Nothing from birth to death,
One other one.
only one Aadhaar, one photo, it will identify. So this is where I am asking you, health profile may change continuously. Telephone number may change. Village won't change. Village boundaries won't change. Migration may happen. That is where
Aadhaar will not change.
Aadhaar won't change. This is where dynamics and static.
We will make a special effort to ensure that this single version of truth on one platform maintained. Any dynamic comes in, we will create some software to update it in a regular basis.
Yes.
We will
That is what you have to do.
Okay, sir.
నాకు 1 year నుంచి మా ఆఫీసర్స్ని మిమ్మల్ని అందరినీ నా లైన్లో తెచ్చుకోవాలంటే చాలా డిఫికల్ట్గా ఉంది. బట్ ఐ వోంట్ లీవ్. ఐ వాంటెడ్ టు పుష్ ఎవ్రీబడి ఆన్ వన్ లైన్, one thinking process.
Just moving on to the next topic, sir, which is
ఇప్పుడు how far you are going to correct it, when you are going to correct this
within
record.
these 3 months, all the data cleansing and new software implementation and all the 12 services will be completed for Kupam, sir. So that we will learn everything how to do it properly here. Meanwhile, we create the physical infrastructure, all those activities for Chittoor. By the time this is ready, we'll start implementing in Chittoor. That is the idea.
Okay.
Next 3 months, we'll only focus on cleansing, purification, implementing correctly, ensuring that everything is working, so that we don't do premature scaling. Only perfect it, then we'll scale it.
No, you make it for me, I'm telling you, data after purification time and again.
Okay.
Accuracy of data 99%, 19.9% or 100%. I want to know time to time.
Okay, sir.
That
We'll
is the-
prepare a dashboard for that one.
Yes.
Okay, thank you, sir. So now one of the important criteria of Digital Now Center is optimizing our resources. Capacity and resource optimization is very important, sir. If you need to do resource optimization, you need to plan it better. That means the patient has to arrive to our health facility. Because not very, only 1 or 2% is emergency. Most of the primary care and secondary care needs are all planned visit we can do. So we make a point that to make every patient have the awareness to come to our facility by planning. Planning is based on appointment. Once the appointment is there, accordingly we'll facilitate the resources, doctors, infrastructure, diagnostics, everything. We just started 4 weeks back, sir. Now out of this 8,732 consultation we manage, out of that 1,344 are the appointment taken and come. Very quickly they are understanding this. But ideally, for a good quality care, there should be 80%. We have reached 15%, sir. We put our best effort to reach. Once we reach the 80%, most of our capacity and resource optimization will become better. So that is an important aspect. We continue to focus this metric very important because so that the government resources and infrastructure is put into use properly, sir. So then comes to actual presentation of child and care on RCH and NCD, sir. Before that, to quickly give an idea. See, today we have about 1,200 women are pregnant in Kupam, sir. Already within last 4 weeks, 394 have come into the DINC model in the system. And it will continue to increase and it should become 100%. Now, on this, when you look at it, sir, this below 18 years, the teenage pregnancy is a big number over here, sir. We need to address it very clearly. And also above 35 is also high-risk pregnancy. So there's a special mechanism to handle high-risk pregnancy and focus both on the awareness to delivery of care. Then comes, sir, in terms of the various stages of pregnancy management, prenatal and actually ANC visit, postnatal and delivery. All of them are continuously tracked to ensure that nothing is missed for a pregnant, and this has been a very closely monitored model from DINC, sir. Now what I would request is Ravi Garmi or Dr. Deepa is our doctor here at DINC to explain how we are managing the RCH using DINC. Over to you.
Sir, Dr. Deepa, మీకు గుర్తుండొచ్చు, she topped 10th standard in 2010 and you felicitated her. Now she is a DNC doctor. I want her to tell in her own words a patient's journey and how she feels DNC has played a role.
Yeah.
Deepa,
She is our medical officer, sir.
Yeah.
here in DNC.
Okay, ma.
Good morning, everyone.
Anand.
And
నా పేరు డాక్టర్ దీపా సార్. ఇంతకుముందు రామ్కుప్పం పిహెచ్సిలో 2 years వర్క్ చేశాను సార్. ఇప్పుడు డిఎంసీకి డెప్యూటీ అయ్యాను. నా ప్రాపర్ గుడిపల్ లేదు సార్. ప్రజెంట్ ఇప్పుడు ఫర్ దిస్ ప్రెజెంటేషన్ ఐ హ్యావ్ టేకెన్ ద కన్సెప్ట్ ఫ్రమ్ ద పేషెంట్. ఇవాళ నేను ఒక ప్రెగ్నెంట్ మదర్ గురించి తన జర్నీ డిఎన్సీతో ఎలా ఉంది అని చెప్పి చూపిస్తాను సార్. పేషెంట్ యూహెచ్ఐడి నుంచి సర్చ్ చేస్తుంది సార్. బికాస్ ఎవ్రీ యూహెచ్ఐడి ఈస్ యూనిక్ టు ఎవ్రీ పేషెంట్. పేషెంట్ డీటెయిల్స్లోకి వెళ్తే సార్, పేషెంట్ నేమ్ వెన్నెలా, 22 years old, and she has her own ABBA ID, logged in with mobile number, and she is hailing from Menkotapalli, Nulukunta, sir. వెనెలా పేషెంట్ జర్నీ డిఐన్సీతో ఎలా స్టార్ట్ అయింది అంటే, ప్రతి నెల 9వ తేదీ మనకు పిఎంఎస్ఎంఏ జరుగుతుంది సార్ ఎవ్రీ పిహెచ్సిలో. ఆ రోజు తను ఆశాతో పాటు పిహెచ్సికి విజిట్ చేసినప్పుడు అప్పుడే మనం కొత్తగా స్టార్ట్ చేసిన టాటా డిఐసి నర్వ్ సెంటర్లోని అరీనాకి వెళ్ళి పేషెంట్ రిజిస్టర్ చేసుకోగా అక్కడి నుంచి అదే టైంలో లామా సెషన్ అంటే యోగా సెషన్స్ జరుగుతున్నప్పుడు మన డిఐసి గురించి తెలుసుకుంది సార్. యోగా ట్రైనింగ్ ఇవన్నీ తనకు మనం ఇచ్చిన సర్వీసెస్. ఇప్పుడు తను 9th మంత్ ఆఫ్ ప్రెగ్నెన్సీలో ఉంది సార్. అపాయింట్మెంట్స్ చూసుకుంటే తను ఏ ఒక్క అపాయింట్మెంట్ మిస్ చేయలేదు సార్. వీ మేడ్ షూర్ షీ విల్ కమ్ అండ్ విజిట్ ద పిహెచ్సి ఆర్ ఏరియా హాస్పిటల్ టైమ్లీ. ఫస్ట్ సెషన్ June 9th తను హాస్పిటల్కి విజిట్ చేసింది సార్ ఎన్కొత్తపల్లి పిహెచ్సికి. ఫస్ట్ యోగా సెషన్ అటెండ్ అయింది సార్ June 9th. ఇక్కడ ఆల్ టైప్స్ ఆఫ్ స్ట్రెచెస్ తనకి అడ్వైస్ చేయడం చేయించడం జరిగింది. ఇక్కడ ఎవ్రీ మంత్ ఇప్పుడు తను 9th మంత్లో ఉంది కాబట్టి ఎవ్రీ వీక్ తను కాల్ చేయాల్సి వస్తుంది సార్. ఎందుకంటే తన డెలివరీ ఎప్పుడు వస్తుందో మనకు ఐడియా లేదు. సో ఎవ్రీ వీక్ తను ఎలాంటి జాగ్రత్తలు తీసుకోవాలి, ఎలాంటి ఫుడ్ తీసుకోవాలి అని చెప్పి పీసీసీస్ తనకి కాల్ చేస్తారు. ఇన్ కేస్ సిస్టర్స్ అడ్వైస్ కావాలంటే సిస్టర్స్ కాల్ చేస్తారు సార్. హై రిస్క్ అయితే తనకి ఏమైనా కాంప్లికేట్ అయిందంటే మేము కూడా కాల్ చేస్తాం సార్. ఇది సార్ డ్యూరింగ్ కాల్ ఓన్లీ వీ విల్ కౌన్సిల్ దెమ్ సార్. ఎమోషనల్ సపోర్ట్ అండ్ తను ప్రైమరీ సార్ ఫస్ట్ ప్రెగ్నెన్సీ. సో తను భయపడకుండా తనకి ఎలాంటి జాగ్రత్తలు కావాలి ప్రతి ఒక్కటి స్టార్టింగ్ నుంచి చెప్పండి. సార్ ఇలా తను ఎలా తెలుసుకుంది అని అక్కడ చెప్తాను సార్. అక్కడ నుంచి June 9th అటెండ్ అయిన తర్వాత 11th తనకి కొంచెం హెల్త్ బాగాలేకుండా అక్కడ వెళ్ళి మెడికేషన్ తీసుకున్నారు కానీ తగ్గలేదు సార్. తగ్గకపోతే మన డిఎన్సీకి కాల్ చేశారు సార్. చేసినప్పుడు కాల్ ఫస్ట్ కోఆర్డినేటర్స్కి కనెక్ట్ అవుతుంది సార్. అక్కడి నుంచి తను రిక్వెస్ట్ చేసింది, సార్ నేను ఇలా డాక్టర్తో మాట్లాడాలి, నాకు ప్లీజ్ కనెక్ట్ చేయండి అని చెప్పి. సో 12th డాక్టర్ యశ్వంత్కి కాల్ కనెక్ట్ చేశారు సార్. అంటే ఆ టైంలో ఎవరు ఫ్రీగా ఉంటే వాళ్ళతో కనెక్ట్ చేపిస్తారు సార్. ఇలా డాక్టర్ యశ్వంత్ మై కొలీగ్ కాల్ ట్రాన్స్ఫర్ చేయగా తనతో మాట్లాడిన సంభాషణ మొత్తం ఇక్కడ కేర్ డెస్క్లో ఎంట్రీ చేపిస్తారు సార్. అండ్ హీ మేడ్ షూర్ it is not high risk and she is safe. He assured that she need not to worry అని చెప్పి అష్యూర్ చేసి ఇచ్చిన తర్వాత మరుసటి రోజు అపాయింట్మెంట్ బుక్ చేసి హాస్పిటల్ విజిట్కి రండి, మీకు గైనకాలజిస్ట్ కన్సల్టేషన్ మరియు అల్ట్రాసౌండ్ చేపిస్తాము అని చెప్పి చెప్పారు సార్. అండ్ ఇన్ కేస్ ఆఫ్ ఎమర్జెన్సీ టోల్ ఫ్రీ నెంబర్ కూడా చెప్పడం జరిగింది. ఇక్కడ హాస్పిటల్ అపాయింట్మెంట్ చూసినట్టయితే కంటిన్యూస్ గా వాళ్ళకి తగ్గిందా లేదా, ఇప్పుడు ఎలా ఉన్నారు అని చెప్పి ఎవ్రీడే విల్ మేక్ షూర్ వి విల్ కాల్ హర్. ఇలా 38th వరకు June 2nd వరకు ఆ కేసుని ఫాలో అప్ జరిగింది సార్. అండ్ నౌ షీ ఈస్ డూయింగ్ ఫైన్. ఇప్పుడు 9th మంత్ కాబట్టి డెలివరీ టైంకి తను ఎలాంటి జాగ్రత్తలు తీసుకోవాలి ఎక్స్ప్లెయిన్ హర్. అంటే నార్మల్ పెయిన్స్ ఎలా ఉంటుంది, డెలివరీ పెయిన్స్ ఎలా ఉంటుంది, ఎడ్యుకేషన్ అండ్ బర్త్ ప్లానింగ్.
ఆవిడతో మాట్లాడిన తర్వాత యాజ్ ఏ ప్రెగ్నెంట్ లేడీ యాంగ్జైటీ ఉందా, అందులో యాంగ్జైటీ లేని కేటగిరీ, మీడియం యాంగ్జైటీ, హై యాంగ్జైటీ పెట్టుకొని అక్కడి నుంచి proactive counseling has to be started.
Very good idea.
Even that also you integrate in that, so that we'll have a clarity how to monitor.
Thank you, sir. Very good idea, sir. We'll implement
Yeah,
that because we have not done that classification.
Yeah.
If we do that classification, you can focus on high anxiety people more.
Yes.
To ensure that, sir.
అది ఒకసారి వర్కౌట్ చేయండి.
Next. I will hold the mic, you can talk.
Here we can see everything is digitalized. MCT card, behavioral investigations, lab investigations.
హాస్పిటల్లో తను చేసిన విజిట్స్
So for everything, for audit trail, backup document is also, sir. Now most important about DINC, sir, this is a health industries and health sector, sir. What happens is, more than 85% of the data is unstructured data. Whereas in banking and financial services, manufacturing, everything is structured data. So that is the reason managing health system through an IT is very difficult. So what DINC software is doing, sir, this unstructured data automatically with our intelligent over experience and also using AI, it will convert into semi-structured or a structured data. So that any analytics, any analysis will automatically come, which we have not yet implemented in Kuppam, sir. We will start doing it once the data becomes clean, sir.
Yeah. Another thing you have to do now, all mobile Talle Bidda Express or ambulances, if you can integrate with this, then they will go to doorstep, they will do diagnosis, clinical test, everything. That has to be linked with this.
Absolutely, sir. That part of the plan is there because every 15 days they are going for the village clinic with the mobile van and address it. Now that services we should bring in, otherwise data will not be complete. So we will
Automatically they must be in sync with DINC.
Correct, yes. It has to be
Then they have to update automatically, real time, so that you will have that data also for consultation, for treatment, for everything, action plan. Third one is another thing, you are going for diet prescription. There are two, preventive health. One is yoga you are doing. Make it yoga regular frequency, how much time, not once in a way. Then that if you can take, if necessary, not only hospital, from home also you can teach online.
once the mobile app, patient app comes in, they can use it and then.
Online, from teacher will be here in the studio, 5, 10, 20 like that. They will start session, they will do it, you will guide them. That is another. Third one is only one more thing you have to do, diet, nutrition. Nutrition if you can do properly. We are having one app also, I have done voluntarily as an NGO, Nutriful app. There we are entering everything. Daily, pregnant ladies especially, you can add continuously. You will know what type of diet they are taking, protein, everything, what child needs nourishment, how they are taking. Both time, everything you can monitor and cumulatively everything. Basing on that outcomes you can take and then compare both. Body to body it will differ naturally, but ultimately these two will synchronize, then that will be a guide. That is where I wanted to prove it. Some universities are working that project, a proof of concept. They are having nearly 5 lakh people are online now, Nutriful app. Why can't you make Kuppam also as a part of it, and then it will be useful for you, which is working. Your dietitians also, your doctors also will follow. This is the diet pattern she is following.
Okay, sir.
That
We have done something on the NCD patient in Bangalore, sir, for diabetic patient. We'll bring.
No, not only diabetes. I am telling you,
For all.
for everybody, food is a medicine. I am making now kitchen as a pharmacy, food as a medicine. You eat required food, nutritious food, you can avoid problems. That is one. Third one is what I want to do, this also you have to keep it in mind. Clinical blood test once in 3 months. If you do that, what is the cost? Basing on that,
Treatment.
any imbalances, you have to balance it. Suppose micronutrients imbalance, iron deficit, some other deficit. How to make that deficit, how to fill in. If you do that, then health will be perfect. Sometimes tablets form, sometimes nutrition form. You have to do continuously, then hospital expenditure will reduce. Preventive health, one is yoga every day, half an hour, 1 hour, one is food, one is test. Once in a year, I don't know it is possible, every person will have a checkup. Minimum parameters, top 10 parameters, you will go for checkup, routine. You will give a schedule. This hospital, what are all the treatment, how many people we can do it, we can give a schedule. Once in a year they will come, they will check up. Then we will take futuristic, preventive measures.
You have care planogram to show.
Upon your direction, sir, one small thing. Upon your directions, we are starting 47 diagnostic tests in mobile medical units itself.
That is what I said, there you can do it, all these
We are
things.
doing it on a pilot project. We are doing it in 34 vehicles, sir. Those vehicles can be used here first.
In one or two vehicles, if you can put it, then need-based, continuous one cycle, this mobile vehicle will go, 34 is okay, some more test has to be done, then we will bring here.
Yes. USG is part of those diagnostic tests.
యూఎస్జీ పెడతలేదు సార్, ఎందుకంటే అది గైనకాలజిస్ట్ కావాలి. అంటే మనం బ్లడ్ టెస్ట్లు, సెరమ్ క్రియాటిన్, అంటే మనం ఏదైతే గ్లూకోజ్ లెవెల్స్.
నాకు మీరు ఒక్కసారి చేసి నాకు చెప్పండి. అల్టిమేట్గా నేను మొబైల్ అండ్ ఆల్ దిస్ ఇంటిగ్రేషన్, అదర్ థింగ్ యూ హ్యావ్ టు బ్రింగ్ ఇట్. Bill Gates Foundation also, madam, you have to come here. You are not a silent spectator from now onwards. You are a active participant, bringing all challenges you have to address. Now, even you have to work with MedTech zone, wearables, cost-effective wearables, they will have. Then pregnant lady, tension, you are monitoring. Put one sensor, real time will monitor. Then we will have a
Real-time data.
real-time data. Then you can take a action. Now I am sleeping morning by seeing my sleep score.
Exactly.
Or this one. Okay, less, then I will increase half an hour, 1 hour sleep, charge our body. The days are count. Even glucose levels. This is where I am asking you, all critical, crucial patients, don't bring to hospital unnecessarily. Have this one, immediately there is ambulance. You want to pick up logistics, half an hour, 10 minutes. Real-time monitoring, preventive health and curative health. These three are very important. Then only cost of, I am requesting you are spending 19,000 crores on health. You have to, all of you have to reduce at least 25% health budget, not increasing in future. That is my target. I am telling you.
Is a dent to my budget.
Not budget, you are going to help. What you are giving, pharmaceuticals. Medicine is a medicine. There is a negative effect. Or otherwise you are cutting the body. Original body you are cutting unnecessarily. All operations, everything. I want to change that scenario.
Sir, now quickly, we'll go through a...
Ultimately, one more thing I will tell, then you have to integrate. Population management, not population planning. Now we have to go to population management. One agency they are working.
We'll work with
You take them and also we'll integrate them.
Okay. We'll work
Okay.
with them. Sir, quickly what I will do, sir, now, the taking a non-communicable diseases, the continuous connected proactive care using AI. How it can be delivered in Kuppam. We have prepared all the technology, but once everything matures, we'll roll it out very quickly. Ravi Garu will store the whole thing, including the AI and app and everything, sir. Please, Ravi, over to you.
Sir, Tata MD last 1.5 years nunchi we have been developed our own artificial intelligence platform. 2 minutes background on it. Many people are developing artificial intelligence. Over the last 10 years, Tata has experience of treating and managing about 60 lakh patients. And out of them, for 30,000 patients, we have longitudinal data for 8 to 10 years. That includes diabetes, hypertension and so on. Now this rich data repository has told us what events occur at what time and what kind of manifestation, what treatment works. Now this, apart from this, we have 100 specialists we had onboarded who had collected all the data, looked at the data and put this into a master repository which we call Master Care Planogram. Care Planogram ante sir, planogram is planning a journey. From the retail industry, the term has come. So you know what all to do at what time as based on the patient's manifestations, lab results and so on. The master care planogram ni vector database lo pettam. Now whenever a patient comes to us, valla data తీసుకొని, if you feed it to this AI engine, it goes and picks up whatever is relevant to that patient and generates a very personalized care planogram. Ma Bangalore Health Center lo, Urban Health Center lo, we've treated about 7,000 patients in the last 1 year. More than 3,500 of them we have used the care planogram. It has been independently assessed by Indian Institute of Science people, and they have shown that following care planogram, clinical outcomes are excellent in diabetes, hypertension, obesity. We track the, I will tell you sir, the improvement is tracked in a very objective manner, which I will show you in the, that will be the last part of my this one, called True Wellness Meter. Adi emiti, ela configure chestam, ela monitor chestam.
How well are you doing this minute? The True Wellness Meter you will see.
Yes.
For every patient, how well are you, like the way you slept last night, you have the sleep monitor. You have your plus all the assessment data, your previous diagnostic data, everything is looked at it. For a 85-year-old, 90-year-old, BP is 160 by 90 means okay. For a 30-year-old person, it is not 120 by 80 which is a problem. Personalizedly for that person, with respect to his health, how well is he doing this minute, is the concept of True Wellness Meter, which is a beautiful product which was created.
But also, is there any device to measure, or
Yes.
only field factor?
No. It is sir 70% based on clinical parameters, 30% weightage is given to lifestyle factors. That is the way, and in clinical parameters, based on the patient's problem and his lab levels, daniki weightage istam sir. Based on the weightage, we have generated an AI program, automatically it will give the score. I'll show you in the end what we will. My colleague, Wing Commander Dr. Amandeep Singh, ఈయన నేను మా టీం కలిసి చేశాము. He will live demo to you how this AI app is used. It is available both on mobile phone and tab. Today is showing on tab. Aman.
Namaskara sir. It is my honor that.
You show that with Ravi.
Yes sir. Sir, this is AI enabled consultation sir. The moment the patient comes to the doctor sir.
You enter, Ravi will speak.
Yeah.
It becomes easy.
Sir, okay sir.
Sir, you can, as soon as you enter the patient's mobile number, the AI gets activated and it loads the patient's profile. In this case, we are.
One second, Ravi. Sir, what happens, sir, when you are there with the doctor consultation? The doctor has to focus on the patient. But after bringing EMR and HIS, the doctors are entering the data in the computer, and their time to focus on patient is reduced. This is problem number one. Problem number two, the efficient doctor's time, because we have doctor's time has been made efficient. So now what we have done is this AI, which will automatically listen, which is everybody does it, but more importantly to ensure the clinical care planogram parameter is being fully tracked. Now he is going to switch on the doctor consultation, show the doctor consultation first.
So the moment that we enter the patient's mobile number, it will show up the patient details. It will open up the clinical listener tool where the app will ask for the consents. And since the procedure involves, as Girish sir has mentioned, that we have to make the more doctor-focused patient care, the doctor can give a pause, examine the patient, and then he can resume and verbalize all his findings.
Now what happens, sir? Yeah.
So what happens is conversation, sir. So based on our 30,000 patient data and various prescription, everything, it goes into a standardized clinical notes automatically it prepares. So that what doctor is thinking, how he is doing, everything is understand, and goes to our 30,000 database, then goes to 3 million database which is there in the AI world, looking at everything. Finally, it prepares a one-page notes for this patient. This is the situation. This is the treatment.
As on today, what is the accuracy you are able to reach?
We started with 70% in last June, sir. We are 98% accurate today. And this is the international standard structured clinical summary, where all the patients' findings and advice given and the medication. Dr. Garu actually has to verbalize. Paracetamol 2 సార్లు తీసుకోవాలి భోజనానికి తర్వాత అని అవన్నీ ఆయన చెప్పారనుకోండి, ఆటోమేటికలీ ఇన్స్ట్రక్షన్స్ ఆర్ ఆల్సో పాపులేటెడ్. దిస్ ఇస్ అవైలబుల్ టు ద పేషెంట్. ఈ స్ట్రక్చర్డ్ సమ్మర్ నుంచి ఆటోమేటిక్గా ఎలక్ట్రానిక్ హెల్త్ రికార్డుకి వెళ్ళిపోతుంది. నెక్స్ట్ సార్, we were telling you about care planogram. AI automatically generates a care plan.
Sir, this is the most powerful thing, sir. What it is for that patient, personalized care planogram for next 18 to 24 months, how you have to treat this patient, and next 90 days what you need to treat him, and how do you need to follow up. Every activity is listed. How frequently, this not only medication, it is lifestyle, diet, nutrition, exercise, everything it will identify and give the plan. Now what happens, the beauty is that if you have this plan, the patient is going to see that in this app that this is my plan, and then our DINC health companion, our coordinator is also going to say, so that both of them has to manage like a project whether you are doing it or not, and this will automatically improve your score of your health.
Now we'll show you the wellness meter, sir. This is how the wellness meter looks.
Not come yet, not looking.
Yeah. For this patient actually we had monitored 2 wellness meters, and we can see here, sir, we had one wellness meter which at that time was manual. In this wellness meter, using all her parameters that we input, her score initially when she enrolled with us on a scale of 100